Hey, what's up, everybody? Again, it's your boy Montoya Smith, aka Black Socrates. I ain't gonna keep y'all waiting, but not gonna, yeah, definitely not gonna keep y'all waiting. But I wanted to highlight some information I just found out. Some of you may have seen me on the Ray's Corner talking about the coronavirus a couple of maybe a week and a half ago, maybe. Um, Ray, the guy that runs Ray Corner, he had seen some of the information I had been putting out on the Mental Dialogue page. If you are a regular follower of what we do at Mental Dialogue, I call all my audience and followers truth seekers. And so I definitely felt obligated over the last few weeks to try to get what the scientific community was saying, despite what you may have been seeing in the news and politically and things of that nature. I don't watch too much TV, so I got some wind of it. Um, but again, as this thing was kind of coming to fruition, is really even before we halted to kind of where we're at now. A lot of the information at the time was showing that the projections of the number of cases and unfortunately even possibly the number of deaths that the coronavirus could cause was so alarming that you saw governments around the world kind of start to take action. And then there's been a lot of political back and forth about whether it was done soon enough, whether it was done correctly. And there's also people right now that are still saying this is the situation with this health crisis is tied to a lot of other things, such as um, martial law and the things that they're setting us up for martial law and things of that nature. And this video is not about whether that's right or wrong. I just want to bring some new information that's come out recently, scientific information, and to explain why I love focusing on the science of something of this nature versus politically what's being said, or the left and right and the egos of it. So, and just to kind of show people, I feel like it's a teaching moment for understanding how those of us who prefer scientific data and things of that nature, how we're using that data. Because quite often people that are maybe listening to politicians or very political or kind of strong in their beliefs, quite often when somebody like myself or others of those who like to share scientific data, sometimes they believe we're sharing the scientific data in the same manner, meaning that, okay, we've looked at this data and we believe this is exactly what it is. Well, the example of the new data that's coming out, that's naturally what would happen is the longer this thing goes, the more data points, the more people they can study, the more information they can get about this novel virus, which means new virus. And so I wanted to give this example to show that even for those who are supportive of what the scientific community is saying or doing, that science loves to correct itself. Like I tell that to people all the time. So even if I'm dialoguing with you and giving, for example, any of you, if I'm going back and forth and giving you, here's the scientific data, I'm not giving you the scientific data as if it's the end all be all. I'm just saying, here's the data right now that based on the consensus in the community, the scientific community, that seems to be the data for why we're making decisions. So for example, when it came to the projections, which is what the issue has always been, for the last 2 weeks I've been going back and forth about people saying there's only so many deaths, why are we so alarmed? And I would always say, in this situation, the actual deaths that are being caused, because when it first started, the deaths naturally would be small. And I said, so the deaths are not the issue. According to the World Health Organization, the mortality rate seems to be high on this new virus, and they're worried about it being not only spreading around the world, which the WHO came out from the beginning and said they understood that it would spread around the world because, as you may have heard, this has been a smart virus. Smart virus meaning that it didn't show symptoms in the first 4 to 7 days, and now I'm hearing even up to 2 weeks. And so anytime any virus, if it doesn't show symptoms, the ability to spread is almost impossible to contain it because you're spreading it while you're not sick. I've given this example on previous videos, and I'll give it here just in case it's your first time watching. But the flu or the cold, when you get the virus, you're going to show symptoms within 24 hours. So because of that, you can almost quarantine yourself, meaning even if you're going to work or going to school, you cannot shake people's hand when you got a runny nose, or they can stay away from you because they see that you have symptoms. And so had this virus not been a quote unquote smart virus and had showed symptoms, we probably would not be in the state of the world we're in now, in reference to how quickly it spreads. But again, the bigger issue, well, that was the biggest issue as far as being able to contain it. Then the other issue was if the mortality rate was in fact as high as they predicted it in the beginning, that it would take out way more people than some of the past pandemics or the past viruses that have hit the world. So I want to give that context to talk about the new information. So the new information, again, this is why I love science. So when people were sharing the mortality rate, I had people pushing back saying those numbers cannot be accurate. Even the WHO is putting out, that these numbers may not be accurate. And science understood fully well that the models that they were using, while there were not a lot of cases to study, they fully understood that these may not be the actual numbers, but these are the best they could do while having smaller numbers. And as they got more numbers, then the mortality rate, one, can kind of settle in. Different countries have been hit harder than others. But here's the new information that made me do this video. So in me, again, sharing the data up until this point for all the people that kept saying this wasn't an issue and things of that nature, well, I found out that one of the epidemiologists in UK who was renowned, he kind of led the way in Great Britain, for example, because he projected in the beginning that this thing could kill 500,000 people in Great Britain alone. That was what he projected with the coronavirus. Well, as of the last couple of days, that same epidemiologist, I hope I'm saying that right, he has redone his model, and now he's went from 500,000 to 20,000. So that is amazing news, and that is good news. So for anybody I've been in a dialogue with saying, well, here's the data that we have thus far, this is a thing that we should be concerned about. Well, just like a true scientist, as soon as we get new information that says maybe we don't have to be concerned, the people that are doing it, that love science, we're not trying to be right, we're trying to get it right. So when I say science loves to correct itself, could you imagine in politics if somebody realized we came up with this one decision and now we may have a completely opposite decision? In politics, you can't come out publicly and say I was wrong. But right now we have the very same epidemiologist, Neil Ferguson is the one I'm referring to, who, again, one of his early models projected 500,000 deaths in England alone. So the measures that the UK were taking were being driven by, he's a renowned scientist, and so the decisions that country was making on social distancing and what else they might do were being driven by his original model. So, and let me even show you how politics play into this. Again, I love science over politics. So when I first found out, a friend of mine who I've been going back and forth with sent me, well, no, he didn't. I saw it on somebody else's. I'm sorry, I saw it on somebody else's feed, and they were kind of like, I told you so, and told you so from the standpoint of this thing is not as dangerous as we're making it out to be. So when I go read the initial article, the person that posted on the thing, even here's the politics of it. So even in the article, it was written as this guy made this huge mistake in his original model. So you never want to take it straight. If you're going to really source information, you never want to take it from the article itself. So I went and researched the findings of what's going on with the change in the model. And the reality was, it's not so much that the original model was done incorrect or he's saying he's wrong now. What's happened is, just like science does, the more information, such as they've ramped up testing. So his original model was done because at the time they didn't have tests for this novel virus. So he basically went to the UK, to the government of the UK, and says, here's my model. If we do nothing, we are at risk of 500,000 deaths. And so it's not that he was wrong about the original projection. It's now because they've bought time, which is all science has been asking us to do. That's what the social distancing is trying to buy time so they can collect more data and be more accurate. And you hear the term flatten the curve. Well, flatten the curve only happens if we're not at basketball games and at football games spreading it as fast as this thing, none of the scientists have disagreed on how quickly this thing spreads due to the symptomless period. So that is very consistent right now from everything that I've been researching. There's no arguments there. But there are different models that are being tested and pushed as far as what the projections are. Because if the projections come down to something that we can live with, like the flu numbers, then things return to normal. Now, this very same epidemiologist who's, like I said, it's not even corrected, it's just more information to put in the model. And now he's literally moved it from 500 all the way down to 20,000 in England alone. This is very promising because, and there were other critics of the original model who were saying you wasn't considering all those who may already have it because that was something that they could not measure based on the fact that they didn't have a test for it. And so that same epidemiologist took in that consideration that, hey, there are people who already have it, regardless of whether we can test or not. And he took in the information of the fact that they now are, he can see they're ramping up the number of tests. So he's anticipating based on the number of tests, all of these things ensure that it doesn't reach the 500,000 that his original model said. I know that seems like a huge drop, but this is just how science works. So like I said to some of my friends, I says, if you are over the British government and this renowned scientist brings, hey, there's this novel virus that may kill 500,000, are you going to sit on your hands or are you going to make adjustments? You're going to make adjustments while that's the current model. And so because science has bought time, and even that same epidemiologist, even with the 20,000 number, he's still recommending the current social distancing because that's being factored in based on the rate of this thing, the rate of this virus, how the cases. So all of these are being factored into the model. And so I just wanted to say that's good news because that can change everything for us. But I also wanted to, again, use it as a teaching moment to explain that for those of us who do prefer some type of evidence for why you think or have an opinion about something, because a lot of times I was going back and forth with people who were saying, hey, this thing is not that dangerous. And they thought I was simply arguing with them. And I was saying, well, do you have information that says that? And so before, so for those who have said this thing is not this dangerous, if the science so proves it to be true, that's a great thing. But if you were just guessing in the beginning, you can't ask the government or a head of an official of a government to say, well, I don't believe those numbers. No, you got to come in, bring all the best scientists in the world and peer review it. One more piece of information on this thing. So again, I love studying science, love studying the stats and things of that nature. There's also another scientist who received an award for the way he puts together. I don't know if it's a model, but he basically was able to predict damn near to the number on how many cases and China would get and how many deaths they would have. And so they're really looking at that model because he's been able to predict some other countries exactly what the numbers would be. And what he's been using is looking at the actual numbers of death daily. So he's come up with a model. And so he's been pretty smart about being able to see when the coronavirus reaches its peak within a country. And so once he sees that number coming down, his model is projecting very well. And so right now, his peers are reviewing his numbers to see if this model will hold up. Because if that model holds up, then we may be out of the water. Like, because that model is showing we can now recognize with all factors going on. Because I think in the beginning there's a lot of non-factors. Everybody's applauding South Korea for getting the testing and things like that. They really helped their society by getting ahead on the testing. So it's a lot of factors that are now more data points that can be taken to give us more accurate information. So again, why I love science is because science never tries to be static. Science is not claiming to be correct. It is claiming that at this point, with the information we have, this evidence points to this, and what decisions do we want to make while this is the best model we have. But science, as usual, will continue testing its model, putting in more information in its models, coming up with new models to come up with better decisions, and their peers will rate it. So if science had things their way, and you got away from the politics, they would have been sharing with us from the very beginning all the information that they had that would have been shared with the public so that we would have had a better understanding why some of these things we're doing are or are not necessary if science had things their way. But when politics get involved and some of the information gets suppressed, then I'll be done. So something that, for example, with the Chinese government, if they ring the alarm when this thing initially is discovered, then all the best scientists in the world would have converged, and we would have got probably solutions much sooner, or what we might need to do much sooner. But when you suppress it and make it a non-issue for a few months, and you only have, and they have, and from what I understand, they have some of the best scientists in the world in China. So I'm not acting like they didn't have good scientists, but when, like, for example, if y'all remember the big Ebola scare a few years back or whatever, and even though we had a couple people travel to this country, for example, but for the most part, as soon as it was known, all the world's best scientists went there, and so it went away for the rest of the world. It took about 3 years for those three countries that it was a major situation in to kind of get it under control. But we don't know that because it wasn't affecting us, so it didn't stay in the news. So again, I love science because science loves to correct itself. I don't mind saying if at the end of this thing that, and here's what people will do when I'm gone. People will, even if science gets this thing figured out, get a remedy, whatever the case science does happens. So while we're social distancing, they're saying we may be out of this thing in 2 months based on these new models. So if we're out of this thing in 2 months versus the 18 months that was originally projected, people will say, it was never a big deal, not understanding that the time that we gained while social distancing is why science would have caught up to this new virus. That's what they're buying time. They're trying to catch up to. The science and the medicine will catch up. And when it catches up, then the only way that martial law people are going to know if that's correct is if we get this thing under control and we're still under martial law. Like, for those that are complaining about martial law right now, while we're in the middle of a health crisis, you don't know if you're right until it's over and see if things change or not. And for me, who don't think it is martial law, I don't know if I'm right until this thing is over and see if you're right or not. That's the reality. So, whoop the damn dude if they end up calling for martial law and we've seen some cities shut down while we're in the middle of the health crisis. Doesn't change the fact that this virus is spreading. And so you're not right just because they may call for shutting down a city at this moment. That doesn't make you right. None of us will know until this thing slows up and see how much our world changes. If we, what I will say in my opinion, what will happen is we will be better prepared and more readiness after this situation once they get this thing under control. Hopefully, with the new models sooner than later, then we will return back to normal. That's what I believe. And if I'm wrong, then I'll be jumping right on the side of all those people that says it's not right that we're on the martial law. And if it comes to that, then we'll battle that this time. But in the middle of the health crisis, to say that you're right about martial law and things of that nature is kind of silly, since this, again, it's a real thing, even if the original projections were wrong. And science has had no problem saying that. That's why I love science. Science, a politician would never go back and explain it that way. All right, I'm your boy Montoya Smith, aka Black Socrates. Be sure to check us out this Saturday for the Mental Dialogue Talk Show. Have you ever invested in a Black-owned business? Why or why not? Special guest Laditra White, the Ambush King, as well as Rashad Howard and Shadon Reynolds from She Prints It. It's going to be an excellent show getting into, we always talk about buying Black. What about investing Black? How do we sustain our businesses? Do we have cultural issues for whether we will support in a way in which we're investing, or what if you have a business? We're going to talk about how to pitch your business to an angel investor, and the use of crowdfunding, whether it's good or not, things of that nature. So it's going to be an excellent show, 10 a.m. right here on my Facebook page, or better yet, on the Mental Dialogue Facebook page. I always have the show running at the top every Saturday morning live, 10 a.m. to 12 p.m. Eastern Standard Time. If you missed the live version, you can definitely check the podcast out afterwards. But if you are a business owner, and I'm bringing on a couple of angel investors, people that do invest or give alternative methods of finance to businesses. So if you are an entrepreneur that's maybe looking for finance, you're definitely gonna get some pointers. You can call in and talk to our investors. Who knows, they may like what you're doing and become a supporter. So Great opportunity on Saturday for the Mental Dialogue Talk Show. Again, my name is Montoya Smith. All I ask is that you think.